So first of all, I want to commend and thank Duncan for organising this event. As you know, Duncan is running in the forthcoming local elections in Swords for the Labour Party. I want to wish him the very best in his campaign along with his colleagues in the forthcoming elections. As you know, I'm Minister of State in the Department of Health. I'm going to talk to you just for a little while, as Duncan said, about the free GP care. We call it free GP care, but I got slagged off on the radio for saying on the radio recently that there's nothing free, and of course that's true. But what we're talking about is free at the point of access. So therefore, when the person goes to the doctor, they don't have to pay fees. That's what I mean by free GP care. But of course, it has to be paid for in some way, and nobody denies that. But what we want to do is we want to remove what we call the barrier of fees from attendance at your doctor. And that's a really critical thing that we want to do for the entire population. You know that about 40% of the population at the moment, in fact 43% of the population at the moment, don't pay to visit a doctor because they have a medical card, either a full medical card or a GP card. But the other 57% of the population have to pay, sometimes quite heftily. It varies around the country, but in some instances I hear stories of people being asked to pay 60 and 65 euro as a fee to attend their doctor. But just come back more generally, first of all, like, why are we doing this? If you look at the health services generally in Ireland and you ask yourself, how are we going to manage the health services in this country in the future? When you look at the fact that we have an ageing population, which is a very good thing, we're all going to live much longer, from what we can see. We have new challenges and problems of what are called chronic illnesses, which really are the illnesses of the 21st century: diabetes, various cardiovascular conditions, all of the chronic illnesses that are problems in themselves, but also lead to other sometimes very serious illnesses down the road for people, and also the expense associated with all of the new technological advances that we have in healthcare now, which are really amazing. Even in a short period of 5 years, 10 years, what it is possible to do now is you couldn't have imagined even five years ago, certainly 10 years ago, 15 years ago. So we have a completely different world now from what we had when our health services were first set up. The last time we made any kind of a major change to the way we organised health services was in 1970, when we had the 1970 Health Act. So we have to look to see how we're going to manage the health of the population in the future. And there's no way we're going to be able to do it with the current model. There is no way that the acute hospital services can cope with the management of the nation's health into the future. We simply cannot do that. So what do? Well, we look to what we call primary care. And I've responsibility for primary care in the Department of Health. And you know, when I went into the department on my first day, I had a vague idea what primary care was, but I actually asked the civil servants what was primary care. And the answer to that question is care in the community, care and treatment in the community, treatment and healthcare at the lowest level of complexity, closest to where the person lives, to the community where you are. We have to move the focus away from the hospital system that we have back into the community. That's why we need to resource primary care better in comparison to the other parts of the health service. That's why we want to encourage people to go to see their doctor and to go to the primary care services. And we also want to change primary care itself. We want to make sure that we've got a much better concentration on preventive health care, so that people don't see the healthcare system just simply as a place to go to cure you when you're sick, but to actually keep you healthy. So we've got to ensure that what we do, where we spend the money and where we place our priorities, will operate to ensure that people stay healthy, or at least stay healthier for longer, and keep people out of hospital for as long as possible, and keep people Also, help people to look after their own health. I mean, that's a big responsibility that we think primary care has as well. To work with all of us, to work with individual citizens to help us and to help people take charge really of their own healthcare and to have agency for their own health and their own futures. So they're the challenges that we have, and I have absolutely no doubt, no matter what your view is about healthcare, we all like to, those of us in the Labour Party very often look to the NHS, not just people in the Labour Party, but I think people who support a good public health system will often look to the British NHS, that great public policy advance after the end of the war, where this wonderful system was set up, quickly won the support and consent and funding of or willingness to fund the system from the people after that devastating impact of the Second World War, and it was the great public policy advance after the war. Whether you're for that, and some of us might well think, let's have a fully exchequer-funded health system, or whether you're for an insurance-based system, which is what this government is proposing, no matter what your perspective is, as a matter of fact, even if you're a bit conservative about what to do about the future, you still cannot avoid the central imperative here, which is that we have to move to primary care and we have to boost and enhance and improve primary care. So that's the context in which we're talking about under sixes. That's the context in which we're talking about free GP care. And when this government came to office, one of the things that we agreed to do in the programme for government was to introduce GP access for the whole community without what I call the barrier of fees. And there was it was always intended that this would be phased in. Now, there was a particular proposal in the programme government to phase it in a certain way. I didn't think that was going to work. So what we've now looked at is a phasing of this introduction of GP care, beginning with children under 6. And I want to emphasise that this is a first step in a big project. We talk about the under 6s, free GP care for under 6s, as if it's just something, a standalone idea. It's not. I've no doubt that people with young children will be, very pleased that this is something that they can avail of for their children and in their situations, and I think that's a very good thing in its own right. But it's part of a bigger plan. This bigger plan to expand primary care, to get people focusing on what they can do for their own health, and to get people seeing their own doctor, their own practice nurse, the other professionals that are available and can be seen and that you can have contact with in primary care. So we're starting with under 6s. It's a significant move, but I want to emphasize again, it's only the beginning. Our proposal is that this would be available as a service by the middle of this year. June, July is what the government decided. We've put aside 37 million in this year's estimate for this project. We've legislation close to being ready to publish. I would imagine there's a good chance we can publish this legislation by the end of March, which is within 3 or 4 weeks. There's been some stuff in the newspapers and in the media generally about GPs themselves. Are they willing to come on board with this? Are they willing to cooperate with this? I have to say that ultimately I believe they will. I think that they have a fair point to make in relation to some of their queries about aspects of the contract. So we want to go through the draft contract with them. As you know, we published a draft contract about 3-4 weeks ago and asked people for their responses to it. That was the beginning of the process, not the end of it. There are a lot of things in that draft contract that can be changed, that can be improved upon. We want to know from the IMO and the College of General Practitioners and the other bodies what they would like us to do in terms of improving the contract. Come in with their amendments, their suggested amendments. We're very, very, very open to that process. And I've been in touch with the IMO as recently as last week. I met with some of the good few doctors at the weekend, and I've been emphasising over and over again that we need dialogue and we need to work together, and that's what we intend to do. The only issue that really is, I suppose, not subject to negotiation in the old-fashioned sort of traditional sense of an industrial relations negotiation is the fee. The fee would have to be something that's ultimately set by the Minister for Health, but the doctors can have an input in that as well. They can say, look, here's the extra work you want us to do, here's the additional resources that we think we're going to require. They can have that input as well, and we invite them to take the opportunity to come in and to meet us. But to emphasise again, the draft contract is something that's available for negotiation and available for discussion and consultation, and we need to move forward by consensus, and I've no intention of trying to do this by diktat, far from it. So, as I say, the two main aspects of what we're doing, the legislation close to being ready to publish, the draft contract has been published, and we're looking forward to having a good process of engagement with the doctors in relation to this over the coming weeks. So it's part of a bigger plan. It's part of the what I mentioned at the outset, which is changing the way we do our health, the way we run our health services. It's in fact not just something that is desirable to do, I think it's necessary to do. Because I don't think that our health services can survive being run in the way they're run at the moment. Hospital-centred, highly expensive services, particularly when you look at the big challenges of chronic illnesses, which can be managed in the community and should be managed in the community. And by the way, this is a debate that's happening in every country of the world. So, it's quite clear to me that the same challenges are coming up everywhere, and we need to be ready for them. So it's a big change. It's great for people who have children under 6 because it means that they won't have to pay to bring their child to the doctor, and I think that's a really important thing for a lot of people. Sometimes people have suggested, that this is, you're going to be giving free access to GP care to wealthy people. If you're a small family, if you're sort of a family of two, say 2 parents and 2 children, and you're earning household earnings of 35 or 40,000 a year, you wouldn't get a medical card under the current situation. Those people are hardly wealthy. So it's, I think, going to be a huge benefit to middle earners, low and middle income earners. I think so. In its own right, I think it'll be hugely important for them. But let's not lose sight, as I keep coming back, let's not lose sight of what this is about. It's about a big project to introduce universal GP access for the entire population within the lifetime of this government, and that's the objective that we have, and that's what I'm intending to achieve.
So, I suppose, like everything, we Irish can be very cynical of any movement, and obviously with the health over the years, we've just never seen any changes. But you always hear the bad news, and you never hear the good news about the health system. Just regarding the funding of this, obviously you're starting off with the under 6s.
Yeah.
Is that going to be as you were regarding our taxes and everything? Is that going to be just an investment, a sort of trial basis for the government to use this as your first trial basis, and then as you're moving it up, whether you're going to under 10s or the 50s or whatever it's going to be, then you're looking at a tax regime changes? Is that?
Well, it's a good question. I mean, the 37 million that we have for this year for the under 6s, which would be recurring financing in the budget, that's exchequer funded, which we've found from existing resources. Okay, there'll be a cost. I mean, this thing, to do it, if you were going to do it next week, okay, it would cost the guts of 400 million. Now, we don't have that money. At least we don't have it immediately to hand. So it requires, like anything else, the only way for funds to be obtained in government is either to take it away from something else or else put up taxes. Now, the government has a commitment not to put up taxes, and the parties in government have agreed that income taxes won't increase. So there's a lot of hope around that we'll have economic buoyancy this year, and that we'll have higher revenues, and that we'll be in a position. I mean, we're still under we still obviously have to bring our deficit down to 3%, but there's some hope that things will improve this year and next year and in the years beyond that. But it's, there's no we can't magic the funds. My plan would be to press ahead with this, to have a fully costed proposal for government for the rest of the population. I mean, the under sixes is costed. To have a fully costed memo to Cabinet within the next 2 to 3 months, and then the government will have to start making some decisions as to how it should be funded. But I mean, bear in mind, like, the idea is to move resources out of the acute system into primary care. So the point I always make to colleagues is you're spending money, yes, but you're spending money today to save money tomorrow. Like, it is literally an investment. The trouble is you don't get the benefit of the investment in a lot of these kind of measures for a generation, or certainly for a number of years. But you can't afford not to do it, because if we don't do it now, we're going to have a massive increase in cost in the health service in the future. So I've got to persuade people, listen, this is an investment worth making now, so that you won't have to spend a fortune in future budgets on healthcare, because you won't be able to manage it through the hospital system. You have to do it in primary care. So there's a bit of argument to be had in government, but there's no proposal to increase taxes to fund it.